Please note that the information on Retire Vivid referenced in this video is accurate as of May 3rd, 2024. Changes to laws and regulations may make portions of this segment outdated and no longer relevant. The information presented is for educational purposes only and is not intended to provide investment, tax, or legal advice. Please see our full disclosure at the end of this video.
Have until May 31st to enroll for Medicare medical insurance.
Medicare open enrollment runs through December the 7th.
Medicare price negotiations.
For Medicare.
Medicare open enrollment begins today. We're answering your questions about what you need to know to enroll.
Medicare.
The Medicare program for our senior citizens is a great step forward in meeting one of the most critical needs that confront most of our elder citizens. For many, it is a step from charity to security and dignity.
The Medicare program, as we know it today, insures over 60 million Americans, helping protect senior citizens from the financial risk that serious health issues pose. President Johnson signed Medicare into law on July 30th, 1965. Johnson traveled to Independence, Missouri, making former President Harry Truman and his wife Bess the first beneficiaries of the program. The gesture drew attention to the 20 years it had taken Congress to enact government health insurance for senior citizens after President Truman had proposed it. But in fact, Medicare's history dated back even further. When the program was first introduced, it was called Original Medicare, that covered only those 65 and older. It consisted of two parts, Part A and Part B. Medicare has seen many changes over the past 5 decades, including expanded coverage options, allowing more people to enroll, added protections for those Americans who use it, and increasing costs. Despite Medicare being a federal program, the system can feel confusing for even the most informed individual. Having a strong knowledge of the basics of Medicare and the costs involved can help you make a more informed choice to suit your healthcare needs in retirement.
Welcome to Retire Vivid. I'm Karen McCarty, and today's episode is going to be on a pretty large milestone when it comes to your retirement, and that is health insurance. So today we're going to hit on Medicare. And that is why we have Steve Burgett with us. Steve, thanks for joining me.
You're welcome.
So Steve does all of our Medicare plans for our clients. And Steve, I think the big thing when it comes to Medicare, it really can be confusing for a lot of people.
It can be.
You know, because there's a lot of different parts of Medicare. You got Part A, Part B, Part C, Part D, and then you got the other plans in terms of their parts as well too. But I mean, for a lot of people, I mean, it's just confusing.
Yeah, it is. People have a lot of questions.
Yeah, and so that's what we're going to talk about today. So, but before we get into that, I thought it was kind of fun. We were talking about the history of Medicare. You know, we talk about the very first recipient of Social Security was Ida Mae Fuller, and now we got Harry Truman as the first recipient of Medicare. But just for fun, I want to talk a little bit more about that because Medicare has really expanded throughout the years.
Yeah, that was a nice little story, the way Harry Truman became the first enrollee. When he was president, he was really pushing Congress to enact some kind of a nationwide health insurance program for seniors. Well, they talked about it, but they never got it done while Harry was president. Mm-hmm. And about 20 years later, Lyndon Johnson was president.
That's a long time ago, 20 years.
Yes. LBJ was president then, and he was able to get it through Congress. And they passed it, and they called it Medicare. And that's how it got started. And so what LBJ did was to go down to Independence, Missouri, where Harry Truman was living with his wife, Bess. And he went down there, LBJ went down there with his wife, Lady Bird, and he enrolled Harry Truman into Medicare as the first enrollee, and he did it because of the fact that Harry had pushed for it so much earlier for many years. And So they got together and they had a good old time and they got them all signed up.
Good old time.
Yeah. So he was the very first enrollee, and Bess Truman was the number 2, second enrollee.
That's a pretty cool story.
Yeah.
But back then it was just 2 parts of Medicare.
It was.
I mean, it was Part A and Part B. There wasn't the other parts back then.
That's right. Yeah.
And they called it Original Medicare.
Yes.
So Steve, let's talk a little bit about that, because so when our viewers hear Original Medicare, we're talking about Part A and B. Correct?
That's right.
So let's break those up for a second. So what is Part A, and what does it cover? And then what is Part B, and what does that cover?
Sure.
Let's dial into that.
Yeah, that still is confusing for people. Sometimes people will read, if you have Original Medicare, blah, 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 and they sometimes ask me, well, is that what I have? Do I have Original Medicare? What is that?
Sure.
Well, and all they mean by that is Part A and Part B. So, and Part A is hospital insurance. Okay. That's what they call it, and it covers those kinds of things. And Part B is called medical insurance, and they just mean non-hospital, like doctor office and those kind of things, outpatient. So that's what they cover.
Right. And so Part A, there's no cost for that for most people.
For most people, that's correct.
Right.
Yeah.
And then for Part B, there is a standard premium.
There is. There's a standard premium for Part B that Medicare sets every year. It goes up a little bit every year. This year, it's $174.70.
I think a lot of people get confused in terms of okay, when do I need to sign up for Medicare? What are my enrollment periods?
Sure.
Let's talk a little bit about that.
The main enrollment period, really, for most people, is called their initial enrollment period.
Okay.
And that's the one that centers around your birthday. It's your birthday month when you're 65.
Okay.
And 3 months prior to that and 3 months after that. So during that time, it's 7 months, is when most people use that enrollment period to get signed up for Medicare.
To get signed up for Medicare. Now let's talk about that for a second, because there's people that may be approaching age 65 and they're still working.
Yeah.
So that question's going to come up. Yeah. Okay, so if I have my employer health insurance coverage, do I need to sign up for Medicare?
Usually not. The way it works is Medicare says if your coverage at work is what they call creditable, which means at least as good as what Medicare would be. So if your company provides that kind of coverage, then you don't need to sign up for Part B because you're already covered.
Or Part A?
Well, if you have a health savings account, an HSA, through work. Some people have those, some people don't. But if you do, you really don't want to sign up for Part A or B, because when you do sign up for those, then your contributions have to stop to your HSA. And so most people don't want their contributions to stop.
Right.
So they don't want to sign up for Medicare yet.
So the point is, don't listen to the water cooler talk sometimes at work, right?
Yeah.
Because they're saying, hey, Part A's free, just sign up for it.
Some people make that mistake and they do, and then they have to stop their contributions.
Or reverse it, but but that's still a problem.
Yeah, it is.
So we'll talk about that, here in a second, but I also want to touch on the penalties.
Oh yeah.
So we know well about this when it comes to penalties. What I'm specifically talking about is IRMA.
Oh yeah.
Let's talk about IRMA.
Well, yeah. IRMA stands for Income Related Monthly Adjustment Amount.
That's a mouthful.
Yeah, it is. It is. And Medicare puts out this little chart, that's the IRMA chart. And what it shows you is, based on your income, what your Part B premium would be. Now, we talked about the standard Part B premium, that's $174.70 every month. But that goes up. It's means tested based on your income, and so it does go up. And it can go up almost as high as $600 a month for some really high income people.
Sure.
But that's what that IRMA chart is for. It can show you that. So it sets your Part B premium. It also gives your Part D an add-on.
And Part D, for viewers that don't know, is your prescription plan, right?
Yes.
Through Medicare.
Yes. Yeah. So it can affect both Part B and Part D.
Well, some people say, well, hey, my income is not going to be this. Well, what impacts it is Roth conversions.
Oh, sure.
Right.
Yeah.
So if you do a Roth conversion, that's where people get surprised, because they go, what the heck? Why did I get this IRMA letter?
All of a sudden, your income was high that year.
You did. It's right.
It changes every year in terms of IRMA. So, your income might be high one year and back to maybe normal, so to speak, the next year.
This is just the tip of the iceberg. So next we're going to be talking about Medicare supplement plans or Medigap plans, also Medicare Advantage, Part D. What does that mean for you? Stay with us right after the break.
Do you have questions about your retirement plan, or do you want to know if you are on the right track? We are here to help. Simply go to retirevivid.com or call the number below to schedule a 15-minute retirement review. You can speak with us about taxes, Social Security, your 401k, or any quick retirement questions at no cost to you. We are here to make retirement vivid. Schedule your 15-minute retirement review today.
Welcome back. If you just joined us, we're talking about a pretty big milestone during your retirement journey, and that's Medicare. So we just got done talking about Part A, Part B, enrollment periods, if you would, but now we're going to talk about the next piece. So Steve, Medicare Part A and B doesn't cover everything.
No.
And so there's gaps that we got to fill. But before you move an inch, you have to have your Part A and your Part B card.
You do.
Before you can help people, right? But you have a choice. So you either choose a Medigap plan or you choose a Medicare Advantage plan,
Sure.
Part C.
Yes.
Which one do you want to go through first?
We probably should start talking about the supplement plans first, because they came around first. They came around in 1980 when Congress made the laws that enabled insurance companies to offer a supplement to people.
Okay.
And so that supplement would help cover those gaps you're mentioning in A and B.
Yeah.
And so what happened was they created these supplements, all these alphabetical plans. You may have heard of Plan A and B and E and G and F. And there are 10 of them, actually.
The alphabet soup.
Yeah. And they don't just go straight through the alphabet, because over time, Medicare has discontinued some of those plans.
Sure.
Like one that people commonly know about is Plan F.
Yeah, that's not even around anymore.
It's not around anymore for people who are newly eligible.
Right.
But people who had it could keep it. So there are still people I meet with sometimes who have a Plan F.
Sure.
But new people can't get that.
Sure.
But anyway, when people want a supplement, they do pick one of those alphabetical plans, and they do pay the premium for that plan, and then it covers them based on what that plan covers. And those kind of plans, I think as we were talking once before, do travel with you. In other words, what that means is there's no network to those plans. If people have a plan in Iowa, let's say, and they travel to California or Florida or wherever, their plan still covers them. They don't have to worry about, am I in the network or out of the network, or is my doctor in the network, and all that, because there is no network for those supplements, those Medigap plans.
That's kind of nice.
And that's why sometimes people choose those plans, because they don't want to have to worry about being in or out of the network.
Let's say you choose the Medigap plan. They cannot ask those underwriting questions, correct?
Right, that's right.
Let's talk a little bit about that.
Sure. Yeah, that's important, because when people are first signing up, if they're signing up for a supplement or an Advantage plan, the companies cannot ask those questions. They call them medical underwriting questions.
Sure.
People usually think of it as pre-existing conditions, but those are the kinds of questions. And they can't even ask, did you have a hip replacement, or did you have cancer, or did you have a heart problem? They just have to enroll you. You pick the plan you want, and they just enroll you in it.
Got it.
But then what can happen is down the road, maybe 2 years, 5 years later, whenever, if somebody does want to change their plan, And Medicare tells them you can change your plan during this annual enrollment period, which is October 15 to December 7.
Sure.
So if you want to do that, then the company you're wanting to change to might be able to answer those questions. In fact, they usually do. If it's a supplement, they ask those questions, those medical underwriting questions, and you have to answer those questions, and then that can determine what your premium might be, or even if you get accepted into the plan.
Point is if you ever want to change plans, because that could also bridge us into the Medicare Advantage plan.
Yeah.
Let's do that now.
Yeah.
Right. So
Okay.
let's say that you have a friend. People talk. And so let's say you have a Medigap plan, and then you have a friend that says, "Oh, I got this Advantage plan. It's the greatest in sliced bread." So then you move. Let's say you switch to Medicare Advantage.
Okay. Sure.
Now, under Medicare Advantage, they still can't ask those underwriting questions,
That's
correct?
right. With Medicare Advantage plans, they never do ask those questions.
Okay.
So when you're first enrolling, they don't ask. And even if later down the road you change to an Advantage plan, they don't ask those questions, those medical underwriting questions.
But what if so I'm getting deep in the weeds now. So let's just say you had a Medigap plan.
Yeah.
And then you talk to your best buddy and they said, "Oh, I got an Advantage." So you go to the Advantage plan, but then that's you go, that's not really for me. I want to go back to the Medigap plan.
Yeah, yeah.
And then they can now ask you those.
That could be a problem, because then when you're going back to a Medigap plan or a supplement, then they can ask those questions.
They can ask those questions.
And that can affect your premium, or even if you get into the plan or not.
In terms of the cost, because it's all about the out-of-pocket cost.
Yeah.
Just briefly go through that, and I want to move on to the Advantage plans.
Well, the out-of-pocket cost applies to both those kinds of plans. And the way you figure it with the Medicare supplement plans, you pay your premiums.
Yep.
And so you can just add up those premiums. This is what I'm paying for the year.
Mm-hmm.
And then there's also another part of Medicare that's not covered, and that's the Part B deductible. So you add that in, which is $240 a year, and it's an annual deductible. But anyway, you add all of that up, and that's really your out-of-pocket costs for the supplement plan that you have. And so you know what you're going to be paying for the year.
Sure.
And if you want to compare that with the Advantage plans, what happens is you don't pay a premium for most of those Advantage plans. However, what does happen is you can have some cost along the way.
Sure.
And so when you have some costs along the way, that of course can add up. For example, if you're in the hospital overnight, you have a room charge. And there are a lot of things like that could be a charge, and so those can add up. And because of that, since they do add up, Medicare requires all the Advantage plans to tell people what is your out-of-pocket cost, what is the maximum that your out-of-pocket cost could be. And so all these plans have to have a maximum. And all the plans are the same or pretty close. And it's right around $4,000.
We could spend hours on this,
Yeah.
but I only get so much time, Steve.
Yeah.
So make sure you stay with us. We're going to talk more about the Advantage plans. We're going to talk about Part D, and also I think it's good to talk about some pitfalls that people bump into as well.
That's
So
true.
stay with us. We'll be right with you.
I'm Cameron McCarty, talk show host, financial advisor, and business owner.
Did you know Cameron is happily married, raising 4 kids, thinks he's a news anchor?
I don't know about that one.
But did you also know he helps people get retirement ready? He can help you too.
That's why I'm coming to you on the weekends, getting you answers to your retirement questions.
Don't miss him on Retire Vivid, every weekend on ABC.
Okay, welcome back. So we're going to wrap up Medicare. So Steve, I want to dive right back into the Advantage plans. And so, I mean, they are network plans.
They are.
So
yes.
let's address that for a minute.
Yeah, the Advantage plans are network plans. That means they're like an HMO or a PPO, that kind of thing. So you have in-network coverage and you also have out-of-network coverage. But a lot of people are fine with those kind of plans because it's often what they had through work. They had some kind of a group plan through work.
Sure.
And it was an HMO or a PPO, so they're used to that approach.
Yep.
Yeah. But that does mean it's not like your plan travels with you. However, if you are traveling, you still do have coverage. You have out-of-network coverage instead of in-network coverage.
In terms of why somebody may choose a Medigap plan versus the Advantage plan, I mean, or is it just depends on the situation, of course.
Well, it does, and people have their own preferences.
Sure.
But sometimes people do want a Medigap or a Medicare supplement plan because they want to avoid the network thing. They just want to. They like the idea. I want to choose whatever doctor I want,
right?
And I don't want to have to think about who's in what network,
right?
And all of that,
right?
Well, like I say, a lot of people are fine with the networks, and that works for them.
Well, and also too, which is nice with the Medicare Advantage plan, you pay no premium.
Right.
But you could have some costs along the way.
That's right, yes.
You could have some costs along the way. You know, Steve, one thing we didn't talk about yet, which is Part D.
Oh, yeah.
Let's talk about Part D, okay? So let's go back to the supplement.
Yeah.
Supplements for a second. I want to talk about the penalties for a minute. So we talked about IRMA, but let's just talk about the penalties if we did not sign up for Part D. So for example, let's just say you're 65 and you're eligible for Medicare, you sign up for Medicare and you get everything and you go, hey, I don't have any prescriptions.
Right.
You know, I don't need Part D. Okay, fine. And now let's say you're now 75, 10 years later. Now you need Part D.
Yeah.
No problem. Go to Medicare, say, hey, I need Part D. But.
Yeah, but Medicare will say, when were you first eligible? They like that phrase, when were you first eligible?
Sure.
And if you were first eligible a year ago or 2 years ago or 10 years ago, you're going to have a penalty from Medicare on your premium. The way they do it for B and for D, but the way they do it for D, for Part D, is they penalize you 1% for every month that goes by that you did not sign up when you could have.
1% per month. So in this example, that's 12% times 10 years.
Yeah, if you waited 10 years.
Now, is it a slap on the wrist?
It isn't really, because it'd be better for most people if Medicare would just fine them $50 or something.
And be done with it.
And they'd be done, yeah. But no, that penalty continues, and well, how long? Well, it's going to be the rest of your life, because you're going to have Part A and B and D the rest of your life.
Left of your life.
So you'll be paying that penalty.
So it may make sense, even if you don't have prescriptions, to maybe just get D.
It does.
You know, because we get older, and who, I mean, you know, we may have prescriptions.
Yeah, you never know. The next time you go to the doctor, you might get 2 or 3 more prescriptions.
Yeah, right.
You never know.
And so when you're helping people with that, I mean, you go through the formulary with them to see what prescriptions, because what you want to see is who's your doctor. What prescriptions are you taking, right? Those are things you're looking for when you help people sign up for a plan.
That's right. Because every Part D plan has a formulary. Just a list of all the medications.
Got it.
And so you want to make sure that whatever your medications are, they're in the Part D formulary.
They're in Part D formulary. Okay. So now for people who have a Medigap plan, that's an add-on, right?
Yes.
Now Medicare Advantage, is that more grouped into that Part C?
It is. Yeah. If you get a Medicare supplement, like you said, you have to also get a Part D plan to go with it. If you get an Advantage plan, one of the nice things about the Advantage plan is that the Part D is included in the plan.
That's nice.
So it's all in the same plan.
Okay.
Yeah, sure.
But we're not done yet. Oh. So Steve, you thought it was going to be easy today. Okay, so I want to talk about some pitfalls.
Okay, sure.
You know, so I want to talk about some pitfalls. And so I think the first one, going back to the penalties, because that's a big one for people, they don't enroll when they become first eligible. I want you to go back to that, because unfortunately we see that.
Medicare has a penalty for that if you aren't signing up when you're first eligible. And the way they do the Part B penalty is it's a 10% penalty on top of your premium for every year that goes by, every 12 months really, because it can be in the middle of the year or whatever, but it's every 12 months it goes by, you have a 10% penalty on top of your Part B premium. Yeah.
Another pitfall is when you enroll in a plan that does not even include your doctor.
Yeah.
I know you've seen that.
That's unfortunate when that happens. Sometimes some people that get enrolled, they enroll themselves or they go online, they pick a plan, and then it turns out that they've got a network plan, which would be fine, but not if it's not in the network your doctor's in. So sometimes people forget to check those kinds of things, and yeah, that can be a problem.
You know, here's another pitfall where people think that Medicare is going to pay for your long-term care.
Right, it's not.
It's not.
It's not, no. Medicare does cover some short-term kinds of coverage, skilled nursing kinds of things, just for a short period of time. But as far as long-term care goes, which is really considered custodial care, Medicare does not cover that.
And we already talked about the HSA, right?
Yeah.
Meaning if you are working and you're contributing to an HSA, don't sign up for Part A yet. You're not going to get penalized because you have credible coverage.
That's right.
Right? So you know, also beware of that. Yeah. Steve, also working with somebody that's an AHIP certified.
Oh, yeah, sure.
Which you are.
Medicare has a nationwide certification program that they offer, and everybody doesn't go through that. But the reason for going through that series of tests that they have is that once you're certified with Medicare, then you can talk to people about the Advantage plans. So I wanted to be able to talk to people about all the different plans, whether it's supplements or Advantage plans, and let people decide what they want.
I like that.
If people don't have that certification, really they're not supposed to talk about the Advantage plans. They're only supposed to talk about supplements.
Got it.
So yeah.
Steve, this is a lot of great information. I mean, we went through a lot today.
We did.
And so again, thank you so much for being on the show.
You're welcome. Glad to.
And thank you all for listening. I mean, we're here to help you, guide you, give you the tools you need so you can make an informed decision during your retirement journey. I mean, that's why we're doing this show. We're on every weekend helping you get retirement ready. We'll catch you next time right here on Retire Vivid.
Do you have questions about your retirement plan, or do you want to know if you are on the right track? We are here to help. Simply go to retirevivid.com or call the number below to schedule a 15-minute retirement review. You can speak with us about taxes, Social Security, your 401k, or any quick retirement questions at no cost to you. We are here to make retirement vivid. Schedule your 15-minute retirement review today.
Cameron McCarty and Tommy Breitbach are investment advisor representatives of Vivid Wealth Management, a SEC-registered investment advisor located in Des Moines, Iowa. Steve Burgett is a licensed insurance professional with Insurance Plus, LLC. Insurance Plus, LLC is not affiliated with Vivid Tax Center, Vivid Wealth Management, and Vivid Tax and Wealth Advisors. Investment advisory services are offered through Vivid Wealth Management, LLC. Insurance products and services are offered through Vivid Tax and Wealth Advisors and individually licensed and appointed agents. Tax planning and preparation services are offered through Vivid Tax Center, LLC. The preceding entities are affiliated. Information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. Case studies and examples presented are hypothetical and used to demonstrate a concept. These studies do not represent actual clients or results. Similar or even positive results cannot be guaranteed. None of the entities above are affiliated or endorsed by the Social Security Administration, Centers for Medicare or Medicaid Services, or any government agency. Information expressed does not take into account your specific situation or objectives and is not intended to provide investment, tax, or legal advice. Listeners are encouraged to seek advice from a qualified tax, insurance agent, legal, or investment advisor to determine whether any information presented may be suitable for their specific situation. Past performance is not indicative of future performance. Investments involve risk and, unless otherwise stated, are not guaranteed.
Thanks for watching Retire Vivid.
Want to see more? Like and subscribe to our channel to stay up to date with exclusive Vivid content. Plus, be sure to watch our show, Retire Vivid, every weekend. We're here to help you get retirement ready.